Senate is struggling to come together to achieve one of the top issues on the agenda, repealing and replacing Obamacare. The counselor to the president, Kellyanne Conway, explained the president's message to lawmakers earlier this week when he met with them at the White House.
If this fails, they're not blaming the president, they're blaming the Congress. And those members will have to go back home and be held to account among their own constituents and voters as to why for 7 years, 4 consecutive election cycles, they have promised to repeal and replace Obamacare and failed to do it. And I'm telling you, those voters won't listen to the rest of it, which is it wasn't conservative enough, it was too conservative, it didn't do this, it didn't do that.
The latest CBO score shows that 22 million more Americans would be uninsured in this bill, even as the deficit gets reduced by $420 billion over the next 10 years. Joining us now in a Fox Business exclusive is the CEO and president of the Cleveland Clinic, Dr. Toby Cosgrove. Dr. Cosgrove, great to see you.
Good morning, Maria.
Thank you so much for joining us. You've had a knack for taking costs out of the business. You've done it at the Cleveland Clinic.
Yes.
Significantly. How do you take costs out of the healthcare system in America?
I think there's 2 areas you have to look at. You have to look at making the care of people who are sick more efficient, and there's lots of ways the government can do that. First of all, we have to consolidate hospitals across the country. It's the only industry that really has not yet consolidated. We have to look at drug pricing. We have to have interoperability amongst the electronic medical records, and we have to get out from under the burden of the tremendous number of regulations. We've had 14,000 pages of regulations in the last 2 years. And so we have somebody in the hospital all the time inspecting us. All that costs money. And the second thing we have to do is we have to have a healthier population. And we've talked about this before. You have to deal with the epidemics across the United States. Continue to have 18% of the people smoking. You continue to have 1/3 of the people obese, which accounts for 10% of the health care costs in the United States. And then we're dealing with this epidemic of opiates, which I don't think the general public understands the magnitude of the problem. In the entire Vietnam War, there were 58,000 deaths. Last year, from overdose, 62,000 deaths.
Wow.
But Doctor, how do you deal with, though, the element of personal responsibility in terms of opioid abuse, obesity in this country? Because, again, it's a tricky situation of where are you going to have rules and regulations and laws that try to crack down? Like, how do you solve a problem? Is $45 billion in the Senate health care bill directed at targeting that abuse of opioids and heroin? Is that going to help, or is it just wasted money?
Well, let's take them one at a time. Obesity, for example, sugar industry. We continue to subsidize the growing of sugar. That's, to me, money going in the wrong direction. And that is going to be a very difficult thing to do in Washington. If you look at the opiate situation, I don't think the majority of the people in the United States had any idea of the magnitude of the problem. And so you have to raise the consciousness of the whole country, and you're going to have to start talking to children in school about the problem. You're going to have to hear it from the pulpits of churches across the country. You're going to have physicians decrease the number of drugs that they give for painkillers, because 80% of heroin addicts start in the United States with some sort of prescription drug.
Are you happy with the money being allocated to opioids in this bill in the Senate right now?
I don't think just money is going to do it.
Okay.
Thank you. Because that's what she's saying. It's 40 times the amount that President Obama proposed his last year in office.
Well, clearly you need more, and you need
educating.
It's educating and making people understand, and also you just can't have medications out there getting a handful of pills if you get your wisdom teeth taken out, because that goes into the medicine chest. Teenagers are now going into medicine chests and taking the drugs out and using the drugs or selling the drugs. This is a big issue that is getting worse. In 4 years, expected to have 90,000 deaths in the United States.
Wow.
So how do you get doctors to stop writing so many prescriptions? I mean, or do you just say pharmacies can only give a week prescriptions so you don't have a month or 90-day, worth of pills sitting in the closet?
Well, what we do right now in Ohio is outpatients can only get 7 days of pain pills, and children, that's for adults, and children can only get 5 days. And we're monitoring across the state how much drugs are going out. We are starting to see a decrease now in the number given. We've had policies that across our institution limiting the number of drugs, and we're looking at other ways to control pain. 80% of people in the United States at some time in their life have back pain. just giving them painkillers is not the right approach to that. And so we've had therapy in terms of physiotherapy and also psychological counseling, and that has reduced the incidence some 70%.
Now, why is Ohio, obviously where the Cleveland Clinic is based, seems to be really an epicenter here? Deaths topping 4,000 last year just from the opioid crisis.
Exactly. In Cleveland, we have 2 deaths a day.
Wow.
From this. It's really very discouraging, and people are not really sure. I think it's a combination of things. You see people, first of all, who are low income, and you also have people who are on the other end in the suburbs who are high income. So those are the 2 fastest growing areas of growth of this particular problem. But also you see that heroin comes in different kinds. It comes to the West Coast in black tar heroin, and it comes to a much more refined type in the East Coast in white powder form. And the white powder form can be mixed with anything. The other problem is that we're now seeing coming in from China fentanyl and carfentanil. And fentanyl is 100 times more powerful than morphine. And carfentanil is 10,000 times more powerful. And just the dust of carfentanil on your clothes is enough to, kill some people.
Wow.
Well, the epicenter of heroin production, isn't it still like Southeast Asia, right? Central and Southeast Asia?
China is places where fentanyl is coming from, and it's being mailed into the United States. And they're just starting to take down some of the dark web sites where it's being traded. So the DEA has people actually in China trying to decrease this manufacturing.